Now, he did what's called the Everest Challenge on his bicycle, and he wore an N95 mask while doing it. So, to tell us more, we have reached Steve Petrar in North Vancouver. Steve, hello there.
Hi, Gloria. Thank you for having me.
Well, what is the Everest Challenge?
Yeah, so the Everest Challenge is sort of this goofy underground cycling challenge where you attempt to climb the height of Everest, so 8,848 meters, in a single ride, in a single bike ride, as long as it might take you. And so, in a nutshell, that's what it is. And I gave it a shot a couple of weeks ago.
You say it's goofy. How long did it take you to do that?
It took me about 16 hours of pedaling time and 18 hours in total. It took about 2 hours of rests.
Wow. So, how do you even prepare for something like that?
Good question. I think really just putting aside the time, knowing that it's going to take, the better part of a day. And you certainly would need to have a baseline level of fitness and some time on the bike ahead of time to get ready. And otherwise, I think just mentality to go slow and steady and keep going until it's finished. That was really my approach anyways.
Well, you're the kind of guy when you go for a bike ride, you just say, I'm just going to head up Cypress for an hour or two, that kind of thing?
Yeah, more or less.
Okay. I mean, that is an incredible challenge when you're talking 18 hours on your bicycle. Why did you want to do it while you were wearing an N95 mask?
So I've been thinking about doing the ride just for my own reasons. I'm an avid cyclist, and cycling for me is a big part of my life. And so this was something I was hoping to do sometime this spring or summer. And in the days leading up to the day where it was looking like I might have a good weather window to give it a shot, um, it just occurred to me that what if I did it wearing an N95 mask and found some way to document that? Part of it was, I suppose, for some advocacy. I am a healthcare provider, and the mask issue is near and dear to me for that reason. And also part of it just really for a laugh, to see if I could do it, see how long I might last before I would quit, and just see what would happen.
Well, and you made a point, and you are an anesthesiologist at St. Paul's Hospital. Just what has that mask meant for you and your colleagues in terms of reducing the risk of getting COVID at work?
Yeah, of course, it's crucial. The N95 mask is probably the most important part of our personal protective equipment that we would wear, in the hospital, providing care for patients that may potentially have COVID or may be at risk for that. So I've gotten accustomed to wearing an N95 during my shifts, since the start of this pandemic. Not something I would normally wear for a bike ride, but it is an integral part of my PPE at work. And yeah, I think it's been a challenge, I think, for the public to adopt mask wearing, and I totally get it. It's uncomfortable. It's not what we're used to. It can be unpleasant at times, but at least for us working, in a public-facing situation, it's really important that as many people as possible can do that, just to keep one another safe, as well as those of us that are, interacting with the public. So I suppose that was in my mind as well as I decided to do this thing.
Well, good on you. Good on you, really. But there is a difference, isn't there, between wearing your N95 for a shift in the hospital and then wearing it for 18 hours on your bicycle while you're sweating and heading up a mountain. Do you still have that particular mask?
I do actually. Yeah, I have it right here with me. Yeah, I don't know
Are
if you
you
can
going to
see that,
frame
but
it? Do something
no,
special with it?
I don't know. I mean, it was actually just in a bin in my basement after this ride, and I dug it out, and I should probably just throw it away. It's funny because given uncertainties with supply chains, it has at times been necessary for us at work to collect masks and reprocess them. And a few of my colleagues joked, and they did make comments to me along the lines of, they're hoping that mask in particular doesn't find its way back into the reprocessing queue, and I assured them that it wouldn't.
I mean, was there a
Yeah,
point? Was there a point on your ride, and while you're doing the Everest challenge, you're thinking, like, maybe I should have brought one or two of these and just changed them out a little bit, give it time to dry out?
I did bring a spare. I had it in the vehicle. I didn't end up using it. I wore the same one the entire day.
And how did it affect your ride, do you think? I mean, was that just make it more sort of literally in your face in terms of thinking about why you wanted to make a point here?
Um, it didn't affect my ride overly in terms of limiting my ability to complete it. That by no means was a limiter. It was uncomfortable. I mean, there's no doubt. It got sweaty. It gets itchy. It makes it hard to eat and drink as you're riding, which is an important part of endurance cycling as well. You need to keep hydrated and you need to keep fed. I set my own rules for the ride. My rule was pretty simple. It was really just that as long as the bike was moving, the mask was on. So I only took it off when I got off the bike. So that presented a challenge as I got going because I couldn't drink as I was climbing, and I didn't want to stop and lose all my momentum to drink. So I did have to sort of adjust to that on the fly and really drink in between. The ascents and descents. Other than that, to be honest, I kind of almost forgot it was there at times.
Well, that's awesome, but you did add the mask challenge to the Everest challenge. Well, congratulations to you, Steve. I hope you earned yourself a little bit of a rest.
Well, thank you very much. Yeah.